Uric acid crystal. Okay, next one is gout is a type of arteries. There are 127 different kinds of arteries: rheumatoid arteries, gout, and osteoarteries. Rheumatoid arteries is severe inflammation that involve many joints and move beyond musculoskeletal system. Gout. Gout, very painful form of arteries characterized by the formation of uric acid crystal and severe inflammation. Osteoarthritis, progressive degradation of joint cartilage, minor degree of inflammation. This is type of arteries. Gout is type of arteries. Gout. Gout is metabolic disorder of purine metabolism characterized by uh, attack of acute pain, swelling, and inflammation. Chronic heterogeneous disorder of urate metabolism result in deposition of monosodium urate crystal in the joint and soft tissue with accompanying inflammation and degenerative consequence. Most common form of inflammatory joint disease in men age is more than or equal 40 years. Okay. Predisposing factor. Purine rich food. That means food which have more purine, like meat, kidney, liver, seafood, anchovies, oatmeal, certain vegetable like peas, beans, mushroom, cauliflower, spinach, and sweet bread. Caffeine, drug like loop diuretic, and NSAID, non-steroid anti-inflammatory drug. Corticosteroid, niacin, cyclosporine, salicylate, ethambutol, and pyrazinamide. And next one is trauma, infection, other disease like diabetic and hypertension, vascular disease, renal disease, thyroid disease, and sarcoidosis. This is predisposing factor. Okay. Hallmarks of gut. Group of conditions which may be characterized by an elevation of serum uric acid. Recurrent attack of acute inflammatory arteries with monosodium urate crystal demonstrate in synovial fluid leukocyte, bone and joint destruction in some cases. Next one. Uh, Aggregate of uric acid crystal in and around joint, soft tissue, and various organs. You can see the picture. Tophus in bone, leading to erosions in some case. Erosion in some case. Kidney disease and stone. Picture you can see what happened. Okay. Hyperthermia. The hyperuricemia case code is will overproduction when urate overproduction in the situation like dietary purine increase, tissue nucleic acid increase, endogenous purine synthesis increase. When these three increase in urate, hyperuricemia will increase and can cause gut, silent tissue deposition, renal manifestation, and associated cardiovascular event and mortality. Hyperuricemia lead to deposit of urate in the joint fluid, triggering an inflammatory cascade. Stage. This disorder can be progressive through four stages. If untreated, it can be progressive also. Asymptomatic hyperuricemia, acute gout, interstitial gout, chronic gout. Clinical features. Okay, so now what is acute gout? Acute gout is a painful condition that typically affects on only and one of a fusion, only and one or a fusion joint. Sorry, the big toe, knee, or ankle joint are most often affected. Throbbing, crushing, or excruciating pain. Joint appear warm and red. Fever may be there also. Common site of acute flares. Common site. Acute flares may be occur in this site. In pic I will show. Gout can occur in bursa, tendon, and joint. Elbow, wrist, fingers, knee, ankle, midfoot, and 90% in first MTP is this finger of foot you can see, big finger of foot. The attack may go away in a few days, but may return from time to time. Additional attack often last longer. After first gouty attack, half of the people will have no symptom. Half of patients have another attack. This is half of. Okay, interval between first and second acute flares. First and second. Within first year, 62%. Second, between first year and second year is about 16%. Between 2 years to 3 years is 6%. 3 to 5 years, just 5%. After 10 years, 4%. No second in more than 10 years, 7%. This is interval between first and second. Okay, chronic gout. Sign and symptom include joint damage. You can see the picture how is this type of chronic gout. Loss of motion in the joint. You can move the joint. Joint pain and other symptoms most of the time throughout the day. Full the day you have pain. Tophi below the skin around joint or in other place. TOFI usually develop only after a patient um, has disease for many years. This one is advanced for chronic gout. TOFI can be seen clinically with clear obvious deformity demonstrate in hand and foot. See, look at the foot and hand. How is that? You can in this type of chronic you can see clear what happened to the hand. TOFI may be associated with bony destruction on an X-ray. In X-ray, maybe in X-ray it will be clear. Okay, is characterized by massive um, deposit of monosodium urate crystal in articular cartilage, synovial membrane, capsule, tendon sheath, and periarticular tissue. TOFI formation can also occur in eyelid, nasal cartilage, cornea, tongue, vocal cords. You can see the picture. Uh, the tophaceous nodules consist of multi, multi, multicentric deposition of urate crystal and intracellular matrix and foreign body uh, granulomatous reaction. As they enlarge the size, calcify, they can cause pressure symptoms. The toffee are firm yellow in color, that toffee are yellow color. But when discharged is a chalky material. And diagnosis. Okay, criteria for acute gout. The presence of a characteristic urate crystal in the joint fluid or typhus proved to contain urate crystal by chemical means or polarized light microscopy, or the presence of six of the following 12 clinical laboratory and radiography phenomena. First, more than one attack of acute arteries. Second, maximum inflammation developed within 1 day. Third, mono artery attack. Four, redness absorbed over joint. Five, first, first metatarsophalangeal joint painful or swollen. Um, Unilateral first metatarsophalangeal joint attack, unilateral tarsal joint attack, tophus, proven or suspected. Hyperuricemia, uh, asymmetric swelling within a joint on X-ray exam, subcortical kyst without, uh, without erosion on X-ray, 12 joint fluid culture negative for organisms during attack. During attack. Investigation. Plain radiographs may be normal. Serum uric acid, synovial fluid analysis, BUN, blood urine nitrogen or serum creatinine, synovial biopsy, uric acid, urine, Okay, no, this is no, and just step by step, it will explain. Synovial fluid analysis. This is the gold standard. I think that means this is the best one for investigation. The gold standard crystal intracellular during attack, needle and route shape, strong negative briefness. Okay, gout treatment of gout. First, we tell goal of treatment. Rapidly end acute flares, protect against future flares, reduce chance of crystal induced inflammation, prevent disease progression, lower serum urate to total body urate pool, correct metabolic case. Drug use in treatment. First one, non-steroid anti-inflammatory drug. Second one, uh, colchicine. Third one, uricosuric agent. Urico is uric agent. Fourth one, allopurinol or febex, febex, febex stat. Okay, what will do? Non-steroid anti-inflammatory drug inhibit pain and inflammation, inhibit urate crystal phagocytosis by decreasing the migration of granulocytes into the inflammatory area. Uh, endomethacin, this is anti-inflammatory drug, non-steroid endomethacin, naproxen, uh, ketorolac, ketorolac, colchicine. Colchicine produce its this also produce its anti-inflammatory effect by binding intracellular protein tubulin, preventing its polymerization, leading to inhibition of leukocyte migration into affected area, inhibit the synthesis of release of leukocyte. Okay, next one, urico is uric agent. Okay, porobenecid and sulfine pyrazine. They are weak organic acid. Sulfine pyrazine is a metabolic of phenylbutazone. They will increase excretion of uric acid. Next one, allopurinol or febexstat. They will inhibit in synthesis of uric acid by inhibiting exotin oxidase enzyme. Prevention. If we have this, we have to if we have this disease or we don't want to get this disease, we don't have to do this. Mention the concentration of uric acid level with the normal range. Drinking plenty of water. Balance your weight with proper diet and exercise. Avoid purine-rich food. Reducing alcohol consuming. Avoid diuretic drug. Food known to decrease the decrease of gout, like they have to high in potassium, black cherry juice, blackberry and lemon juice. Immediately treating gout will not allow it worse. Thank you. Finish.
Yes, Sanaz. So, students,
Yes,
if you have any question, you can ask her about her presentation. If no question, we'll move to the next.
any question?
I'll move to the next.
No question.
Okay,
No
so who is the next?
Yes, sir, I'm ready. I can join.
Okay, we'll join for you. New link will join.